timeout's called, you stop.
The EMS Timeout, brought to you by Central Ohio Trauma System, or otherwise known as COTS. The purpose of this tool is to create a standardized approach to handoff communication during transfer of care from the pre-hospital emergency medical services provider to the hospital care provider. These guidelines are for voluntary use by Central Ohio Trauma System, EMS, and hospital partners. The purpose of the handoff should be to ensure continuous and safe patient care. Substandard handoffs can cause serious or fatal consequences, including, but not limited to, delay in treatment, inappropriate treatment, care omission, increased length of hospital stay, readmissions, increased costs, and minor and/or major patient harm. When EMS arrives to the hospital bedside and is ready to provide a patient care handoff report, a hospital team member will announce, EMS timeout.
EMS timeout? All right, this is Corbin. He's a 15-year-old male. He's complaining of right-sided...
All hospital staff will be expected to stop and listen to the EMS handoff report prior to patient transfer from EMS cot to hospital bed. Transfer of the patient from the EMS cot to the hospital bed will occur after the handoff report is complete. When EMS completes the handoff report, the EMS member giving the handoff report will ask the hospital staff, "Are there any questions?" If yes, those questions will be answered. If no, the EMS member giving the handoff report will state, "EMS timeout report is complete. Please transfer." EMS will provide the handoff report using the MIST mnemonic. The EMS timeout handoff report will be limited to 30 to 45 seconds. Let's review the MIST mnemonic. M stands for Mechanism of Injury or Medical Complaint History, and will include the patient's name, age, and sex. I, Injuries and Inspections. This will include time of injury and list from head to toe. Also, time of onset, brief medical exam, and the findings of that exam. S, Signs, to include the first set of vital signs and significant changes, including glucose scores. T, Treatment, obtain transfer of care signature also.
EMS timeout.
Okay, this is Tate. He's a 14-year-old male. Chief complaint today is right distal arm pain after falling off of a skateboard. He was not wearing a helmet, but did not hit his head and did not lose consciousness. Denies head, neck, or back pain, just complaining of the right arm pain. Vital signs are blood pressure of 120/76, heart rate is 96 and regular, SpO2 is 97% on room air, and his respiratory rate is 18. We did put him in a vacuum splint. He had good pulse motor and sensation in the affected extremity before and after the splint, and we also gave him 150 micrograms of fentanyl via the MAD device. Do you have any questions?
No questions. EMS timeout complete. Will you please transfer the patient?
Actually, we'll move you over. Keep your hands on your belly. Here, count.
1, 2, 3.
The caveat: when a patient requires emergent attention to airway, breathing, or circulation, or at the discretion of the hospital team leader, the transfer of patient care may occur prior to a formal handoff report. Once an initial patient assessment is completed and the patient is considered stable by the hospital team leader, then a formal EMS timeout handoff report can occur.
The process of transferring responsibility of patient care from one healthcare provider to another is known as the patient care handoff. Guidelines for safe handoffs focus on standardizing that process.
The scripted EMS timeout handoff aims to ensure patient safety through standardization. We are dedicated to ensuring we do what is in the best interests of our patients.
This EMS timeout handoff has been identified as a best practice. The Central Ohio Hospital Council, Central Ohio Fire Chiefs, and the Central Ohio Trauma System are committed to working together to ensure participation and consistency.
Thank you to our partners for your commitment to patient safety.
Thank you for watching this brief video brought to you by the Central Ohio Trauma System.